Hi there, this is Deb, and thank you for joining us for another edition of Second Beauty You. So today I have a beautiful lady here. Her name is Dr. Terri Hill. And Dr. Terri Hill is the proper term, cosmetic surgeon?
Plastic surgeon.
Plastic surgeon here in Ellicott City, Maryland. And the reason why we're talking to Dr. Hill today is because some of us are considering having cosmetic surgery. So my question on your behalf today, and mine, for Dr. Hill is cosmetic surgery for you? So Dr. Hill, thank you so much for giving us some time today.
Sure, Deb, thank you.
I really appreciate it. So can you just tell us a little bit about yourself and your background? And she's highly qualified, but I'll let her tell you.
All right, so as you said, I'm a plastic surgeon, and maybe 20 years ago the title would have been Plastic and Reconstructive Surgeon. I'm board certified. I'm a member of the American Board of Plastic Surgeons and the American Society of Plastic Surgery. I've been in practice since 1991 and cover sort of a range of plastic surgical procedures, including cosmetic procedures and reconstructive procedures.
Dr. Hill,
Yes.
as we get older, and I know particularly for me, I'm starting to see the sagging of my skin and the gel lines. Can you explain to us why that happens and what can be done to correct it, if anything?
Sure. So basically, aging involves a couple of different processes. Number one, there's gravity.
Yeah.
So,
I know that.
and we see that in all areas of our body.
Yes, we do.
So gravity is just constantly pulling down. And so when you see the jowls beginning to form, the cheeks beginning to sag, the lines beginning, a lot of that is gravity. There's also a component where the skin itself changes. It loses some elasticity over time. And there are a number of factors that play into that. So obviously genetics play a role, right? And also lifestyle. So smokers, people who have an extensive amount of sun exposure, unprotected, they're going to tend to have more breakdown in the elasticity of the skin. So that plays a role as well, and that also plays a role in wrinkling.
Okay.
We also have issues where over time the bone, which is the structural support, it begins to resorb or it wastes away a little bit. So all of those factors, when we look at the face and an aging face, we tend to see all of those components. And you may also have some shifting of what we call the soft tissue, the fat in the face and those kinds of things. And some of those structures weaken. So when you see sort of the sagging in this area, mostly that's gravitational. You'll see the creases begin to form here again, sagging. And then we tend to get puffy under the eyes. And we get puffy under the eyes, again, because the tissue itself weakens. So there are what we call fascia or filaments or fibers or layers that hold the fat around our eyes in, okay? And the fat around our eyes is actually a shock absorber for the eyeball.
Wow.
Okay? So it's called orbital fat, and it protects the eyeball. But as that bone of the orbit begins to waste, it begins to sag. Gravity in the cheek area begins to pull away, so there's less reinforcement. And that fat begins to bulge. It herniates a little bit forward. Okay? So when we look at lower lids, what we see is both a falling away of the cheek, which makes the eye look longer and more tired and saggy. And then we often will see the bulging of the fat as well.
So Dr. Hill, how can we correct some of these things? Does it always have to be surgery, or can we use some other techniques such as injections? What are some of the options available?
So the good news is, in 2018 there really are options. So traditionally, we approach lower eyelids with surgery, and the methods vary as well. So surgically you can trim down or remove the fat. You can combine it with a cheek lift and reposition the cheek fat back to the higher position that it used to be in. You can take out the extra skin. You can also do things if it's primarily a matter of the wrinkling of the skin in that area. You can do chemical peels or laser treatments. Laser treatments can also somehow tighten up that tissue. So those are approaches. We can also do camouflage techniques like doing injections along the orbital rim, which acts a little bit like a tent pole, so it kind of pushes that cheek tissue
And where's the
up.
orbital rim again?
The orbital rim's going to be right here.
Okay.
And so if you have the cheek tissue sitting here and you push that up, it makes it look like your cheek is sitting higher, and that will tend to camouflage sort of the hollow look. There are other techniques. So we have a device that's called Viora, uses radio waves. There are other devices on the market. And radio waves heat up the tissue. They rebuild collagen. They rebuild elastic fibers.
Wow.
And in certain settings, they can also melt the fat a little bit. So when you use a treatment like that in the mid and lower face, say from the eyelid to the jowl, you can, for some people, get significant improvement or correction as well. So often it's a combination, but in consultation with a professional who has a variety of tools to use, we usually find we can find an option to treat what is of most concern to the patient that addresses their primary concerns, whether that's cost, downtime, corrective
Speaking
measures.
of
all that.
downtime,
Right.
I guess the downtime would depend on the procedure.
Absolutely.
Okay.
Absolutely.
Now, one thing I found out about Dr. Hill is that she is a Maryland state legislator.
Correct.
So, Dr. Hill, how do you find time to run a private practice and be a Maryland state legislator and remain beautiful on top of all of it? I found out she's also a second. Just so you'll know, second beauties are those of us who are 55 years old and older.
Absolutely.
It's hard to believe.
Absolutely. So, you know what? It takes a lot of teamwork. I have good clinical staff here at my practice, and administrative staff, and I have good legislative staff. They kind of support me, and I think most people that I know and in the second, what did we call it? Second beauty range, are doing multiple jobs. You know, and people don't often see it that way, but if you're raising children, you have a family, you have a job, you're doing multiple jobs.
Yes, absolutely.
And so for me, the importance of stepping up and being part of the political process was really something that I could not step away from. And so we figured out how to make it work, and
That's
I'm
awesome.
happy in 2018 to be finishing my first term in the General
That's
Assembly and
amazing.
running again.
See, second beauty, see, that's what we're always talking about. Don't stop, keep moving. There's so much to do out here. For your retirees, don't
Right.
forget to get up. Let's move. Let's go do something.
It's a great way to go through your midlife crisis.
Dr. Hill, one of the hardest things sitting next to you, ladies and gentlemen watching, to have a plastic surgeon looking at me, because I feel like she's thinking, oh, I can fix that, I can fix that. Oh my gosh. So what would you fix?
You know what? We're not going to be very cautious. When
Okay.
people come to my office, I'm very careful about telling them what I do. What I usually am asking them is, what is it that you are finding issue with? And then we talk about what we might be able to do to address that.
Okay.
And then we'll sort of evaluate. Usually what I do have to do is I have to guide them to look at the whole area. So people will come in, they'll talk about maybe their lower eyes.
Yeah.
And so when I evaluate them, we'll look at the upper eyes, we'll look at the eyebrows, we'll look at the cheeks, we'll look at the whole face, and I'll talk to them about where what they're seeing may actually be impacted by other things. Or if someone comes in to talk about their nose,
Right.
often we're going to also talk about the chin. Because everything's in balance.
Everything's in balance.
Right.
That's
and it doesn't
really
mean that everyone needs to have all areas treated.
right.
But I need to evaluate the area of concern in the context of where it sits and where it finds.
Another question. What about our necks? Because we start to wrinkle, and
Right.
I know that I've heard that facial exercises can be helpful, but is there something that could be done surgically to correct the wrinkles in our neck?
Sure. So facial exercises are about muscle.
Uh-huh.
And for most people, the significant component to an aging neck is, again, the skin quality, the elasticity, the gravitational pull, and whether or not there's extra fat there or there has ever been extra fat there.
Okay.
So the muscle, there's a very thin muscle called the platysma that lies immediately under the neck skin, and that can play a role. And when we do surgical procedures to tighten up, take out the extra skin, we tighten up the muscle, we take out the fat. Again, some of the other techniques that I discussed, the radio frequency or other ways of heating up the skin to rebuild elasticity and rebuild collagen, liposuction to take out the fat.
I never knew you could do it in the face.
Oh, absolutely.
I didn't know that. I thought it was always like in your midsections or your thighs.
And we have really, really fine instruments that can be used in the face and neck. And even things like the cryotherapy, the freezing of the tissue that you'll see with things like Cool Sculpt and that, if it's just a fat issue. But again, techniques are very both in what they target and what they're best for. So if the primary issue is fat and the skin quality is good, it has good elasticity. And what I always tell my patients, if they want to know if their elasticity is good, is I tell them to imagine themselves as a cartoon. And imagine me putting a straw in and going, and if they were cartooning, that sucking sound would lead to everything looks tighter.
Right.
Then they have good elasticity. If, on the other hand, as a cartoon, the sucking sound would lead to and everything would sag. Then they're probably not a candidate for simple fat removal or fat reduction. They probably need to do something with excess skin, lax skin, whether that's to excise it, meaning remove it, or whether to do something to tighten it up.
Are there instances where you would advise against having surgery or any type of procedure?
Absolutely.
Okay.
So I think that the goal is to match the patient and their wishes to what is reasonable, what's practical, and what's possible. Okay. And if those things aren't aligned, then that's a reason to recommend against procedures, whether it's surgical or non-surgical. So if I have a patient who wants to do something non-surgical, but their goal is something that can only be achieved by surgery, then I'm going to try and push them to do the thing that's going to give them the most satisfaction. Otherwise, they're going to put out money and time, take some risk, and be very disappointed in the outcome. If I think that we're just not a match, that the things that I'm able to do and the things that they want aren't going to match, if I'm not going to be able to meet their expectations, if they're too demanding or too unrealistic, then I'm not going to recommend that they have procedures done with me, or to put it another way, I'm not going to recommend that I be their surgeon. And if there are health issues, that's going to affect the recommendations. Obviously, people come in, they've got financial constraints, they have other constraints in terms of lifestyle, and if we can't make that fit, then I'm going to recommend something else.
So Dr. Hill, if you could give any advice or guidance to our second beauties out there watching regarding how to remain beautiful and stay beautiful as we all aged, do you have anything that you would like to share or give any words of encouragement?
I think it's always important to remember that diet and nutrition are important.
That's great.
Taking care of our skin with respect to sun exposure, healthy exercise, and maintaining a healthy weight is important as well.
That's great.
So we do have skincare products and programs that we put people on, and that's also important. And obviously for some people it's more important than for other people. But I would say generally that I would encourage your viewers to not be afraid to go in for a consultation, right? I think some people think that if they go in for a consultation, the doors are going to be locked and they're not going to be allowed to leave until they actually get something done. And you can't make decisions about what is best for you if you don't have information.
That's great.
So I would encourage folks, if there are things they're concerned about. I mean, we've had patients who've come in because of, they've had a tear in their earlobe, right? Who will tell me that they've had a tear for 3 or 4 years and never thought that anyone could fix it, so they never looked into it until they ran into a friend. And I always find that interesting, because why would you not ask?
Yeah.
Why would you not ask your doctor?
Absolutely.
Is there anything they can do about this tear in my ear? So, consultation is just that. It's a way of having someone sit down, give you their professional opinion about what you're dealing with and what the options are. And some people get 2 or 3 consultations. And some people will never decide to have anything done. And obviously for other folks, it's a little bit like redoing your house, right? So you start with the curtains. And you get the new curtains up and you realize that the rug's not quite what it used to be. And
especially when you paint. Then everything else looks horrible.
Everything looks different. But for me, it's not about beauty or lack of beauty. And, my tagline is let me help you unmask.
I like that. I saw that on your website.
But I think that it's about the fact that all of us have a fixed image of what we look like, and that's established about age 35. And over time, as we begin to change naturally, sometimes there's a disconnection, and the person we see in the mirror and the person who we think we're projecting aren't aligned. And if that lack of alignment is bothersome, then it's worth discussing what can be done to bring it back into alignment.
Well, Dr. Hill, thank you so much for taking time out of your busy schedule to speak with me today. I'm sure that all the second beauties out there watching are so appreciative. They've probably had questions themselves and just never had an opportunity to sit down with someone so qualified to answer questions. So thank you so much. Thank you for watching, and don't forget, your second beauty is your true beauty, so let's embrace it and let's go. Bye-bye.